We're just about 1 o'clock, Justin.
Yeah, not quite.
Couple more minutes.
This one says 1 o'clock.
Turned.
I have one.
Do we have folks online? All right, well, we will go ahead and get started. Call the meeting to order for today, Wednesday, May 5th. Happy Cinco de Mayo. Pershing Board of Health meeting. So we'll call to order. And I'd like to ask if there is any move to approve the minutes from April 7th.
I'll make a motion to approve the minutes for April 7th.
Is there a second?
I'll take that.
We'll take a vote. All in favor? Say
Aye.
aye.
Yep.
Any opposed? Okay, we'll go ahead and approve the minutes from April. And I'd like to find out if there is any public input, public comments and discussion. No action may be taken on a matter raised under this item of the agenda until the matter itself has been specifically included on an agenda as an item upon which action will be taken. Public commentary will generally be limited to 3 minutes per person. Anybody like to comment?
None on Zoom? Nope.
Okay. Alright, so we will go ahead and move forward with updates. So current COVID updates. As of today, our total case count for confirmed COVID-19 cases is 954. That is up a few from the last meeting. We had a whole month, 4 weeks with no cases from March 5th to April 5th. And then we had 11 new cases from March 5th to current. And 2 of those cases unfortunately were hospitalized, but have since recovered and are home.
We had,
Those-
last time, I think you said 186 cases. Not, you know,
Yeah, minus
minus the
the
prison.
locals. Yeah, it's
So that-
189.
That number's gone up now.
189 now.
189.
Mhm. So, we we definitely tapered off from where we were before, but we still are seeing new cases, and it's important for people to continue to remain vigilant. So just please continue to be careful and encourage vaccinations. That would be excellent if more people would get vaccinated. Does anybody have questions about the cases that we mentioned? No, okay, so just on that point, we have seen one of the variants of concern. The UK variant is one of the more prevalent new variants of the virus, and one was documented here in our county 3 weeks ago, 2 to 3 weeks ago. And that person has also recovered, was not hospitalized. There are several other variants of concern. There's a report each week that is put out from the state public health lab regarding the variants they've isolated. It looks like right now the most prevalent are the UK variant and the California variants. And so far, this still looks like the vaccine is covering those, which is good. The manufacturers of the vaccine are looking to try to make sure that they are covering variants that seem to break through the vaccine, but so far we look like we're doing okay. So that is good news. The state lab is basically trying to do surveillance genotyping on any specimens they get in for COVID-19 testing right now to keep an eye on that variant status. Lots of interesting things that come out, 70 pages once a week. If anyone's interested and wants a copy, let me know.
Is that what you sent? The other email that you
Yes.
sent? That was interesting.
So we should get another one this Friday, I think. So if anyone wants that passed along, please let me know. Okay, so as far as contact tracing testing, same thing is going on. There's nothing new there except for they're looking at contact tracing presumed cases instead of just confirmed cases. That's a bit confusing. But the Binex Now antigen test was considered probable cases, and they're now considering those as needing to be contact traced. So we are not really using the Binex Now much here, so it's not really going to be too much of an impact on us. But that's just one recent change. And testing, we're doing COVID or the ID Now rapid tests primarily, and then sending out any that are positive to the state lab. We are testing all the hospital staff on a regular basis as continued surveillance, just to make sure that we are safe and keeping the nursing home protected. Mitigation efforts have not changed. PPE we're still good on, I think. And vaccinations, getting along pretty well with that right now. So according to Cheryl and Marcia, the community health nurse, they have done 1,312 COVID vaccines to date. That's vaccine total, not completed series, but total vaccines not broken down between Moderna and Johnson & Johnson, but the majority is Moderna. The MVU did 115 on the first Friday of April and are scheduled to come again this Friday. And that will be Pfizer and Moderna, I believe. Safeway did their pod with 285 doses times 2, and the clinic, our clinic has done 80 to date, and they are scheduling 10 twice a week at this point with the Moderna, but it looks like we have a surplus of Johnson & Johnson now available at the hospital as well. So we will probably start scheduling those folks that are interested in the 1 dose, and that's a little bit easier because it's only a 5-dose vial. Although I did talk to them today about the fact that we're just probably going to need to start having an expectation to waste some doses on occasion. I would rather waste a few doses and get more people vaccinated if we can only get 4 instead of 5 or 8 instead of 10. I don't want to hold up vaccines just because we aren't going to be able to use all 10 since we have a surplus of vaccine finally. Looks like the Pfizer is looking to get approval for vaccinations of COVID-19 for 12 to 16-year-olds. So that is hopefully going to come through next week. We'll see how that goes. We unfortunately don't have Pfizer vaccine here, but maybe we can get some pods in the future to come immunize the children whose parents would like them vaccinated, which I hope is a lot.
So with the pod next Friday, the female
Friday. 2 days.
Oh, it is this
Yeah,
Friday.
It is.
That day after tomorrow. They're gonna do Pfizer and Johnson & Johnson?
Because the Johnson & Johnson was paused last time, I'm not sure if they're bringing J&J or just the Pfizer to complete what they did. I don't know if Sean's on board.
Yeah,
What's up?
Doctor, good afternoon, everyone. So they are going to do 2nd dose of Moderna, and they are going to bring Johnson & Johnson for 1st dose. That's been advertised through our normal channels.
Okay, yeah, 1st or 2nd dose of Pfizer.
Yeah, yeah, that's correct. Pfizer, not Moderna. Sorry.
That's right. Okay, good. So they will have Johnson & Johnson if needed. The calls that we're getting in the clinic, there are not as many people looking to get the Johnson & Johnson at this point, but it is available, and we have a lot available if anyone is still wanting it. So thanks, Sean, for that clarification. And on that note, Sean, do you have anything you'd like to additionally update us on?
So at this point, we've conducted the last of the planned pods. I think we have seen a pretty significant tapering down of demand for vaccines. And I know Cheryl's online, and I talked with Marcia a few days ago, and they indicated that they aren't even filling up all the slots anymore at the health clinic. So I think we're pretty much done with programmed major events, other than this one on Friday, and it only had 115 or so doses of the Pfizer. So not expecting a significant turnout for the Johnson & Johnson either. So I think from that perspective, it's good news that we have, met the demand of individuals who want to get the vaccine. And I think now the next thing we're going to be looking at is we're going to have some vaccine where you're going to have to transfer out or it's going to expire. We're going to have to destroy it.
Yes, so it looks like they're from a national level trying to redistribute that too from places who aren't needing it as much. So I'm not sure if Marcia has been in contact with anybody from the immunization distribution for the state to see if we should maybe just transfer them back to Washoe County, because we know that they are probably more likely to be giving them there versus Las Vegas. Cheryl, are you on? Do you have an idea?
I'm here.
Hello.
I don't know, and I haven't spoken with Marcia on that. So.
Do you know the
unfortunately, I don't have
expiration
an
date?
answer for you.
Oh, sorry. Do you know the expiration dates of the vaccine you guys have in stock right now?
We have some that, well, the oldest ones that we got in, we've used already. So we have 300, and I'm thinking September
Oh, okay.
that it expires. But what we're going to run into a problem, and I spoke with you about it, is that like on the 12th, I have 4 people that need their second dose. Okay, so if we can't fill 6 more slots, are we just going to waste that 6? And I spoke with Kathy Locke about that, and she said that the rural communities, unfortunately, are going to see that, where, we just have 3 or 4, and we can't deny them,
Exactly.
So
I
we want to get everybody inoculated.
Yeah, I think as long as we have excess vaccine available, that's just what's gonna have to happen. And I think we're probably the superstars as far as not wasting much of our vaccine. We've been very, very diligent and good about that. But I think at this point, we're gonna just start having to waste. less
Yeah,
available.
because there's going to come a time where we're just going to waste something.
Less than ideal, but vaccination, getting them vaccinated is important, so. And then we'll be dealing with boosters down the road. I don't have any details yet on that, but it looks like we're gonna be needing boosters down the
Yeah.
road.
So Dr. Van Gilde, do you have any suggestions on how we're going to handle like people that are going to call in for their first dose? So say we have 3 and they need their first dose. And then we waste that, and then they have to come back for their second dose also.
Right. Well, I think because a lot of people are not, haven't been exactly on track with the 4 weeks, and we're also running into a little bit of that overlap between dates and stuff. If it's possible for us to keep kind of in contact with the clinic and you to see if we can kind of combine some of those things, but if not, then we may just have to waste, and that's
Right. And I think too, what we're seeing is because all the pharmacies are open and they're open to everyone. So people are going there for their first dose, second dose, J&J, so I think that's helped actually. So people have more entities to go to. But I was just trying to figure out how we're going to deal with it when we only have 3 or 4 people that want it, and eventually we're going to have to waste it anyway because it's going to expire.
exactly. So I'm saying is, as long as we have a vaccine available and people want it, we just schedule them and give it.
Yeah.
We
Okay.
don't have to be waste. All right. Any other comments about vaccines or questions? Okay, so we will move on to the next topic, which is the Pershing County Transition Plan update. So that authority was transferred to the counties on May 1st. Our plan was approved, of course, and the ultimate goal is to be able to open 100%, and we will be continuing to social distance through the month of May, hopefully with no giant increase in cases. We will be able to eliminate the social distancing as of June 1. And then we're going to be talking a little bit more about other events and intervention or oversight that's needed for any of those. Does anybody have any questions about the transition plan?
You know, we did submit our plan. Sean put that together. The county at our last, no, I think two of them, but anyway, we voted to go to 100% May 1st. Of course, the state ignores that. But anyway, that was our idea, that's our plan. As it turns out, you know, we had events lined up for the community center, and the latest of the big ones canceled as well, so.
Oh,
So we don't have any big ones lined up that I know of.
okay.
So for Doctor and for Larry, this is Sean. So basically our plan is accepted by the state, said that we would open back up and encourage everyone to use appropriate precautions per the current CDC guidelines, whatever those happen to be. So it was a very nebulous thing, and I would argue, I think that it's appropriate for the Board of Health to every time they meet, to review any existing applications or plans that people want to do, and if the circumstances of the case make sense and seem to correspond with what CDC is generally recommending, keeping in mind our local conditions, I think that's a very reasonable thing for the board to be able to either approve or recommend delaying any of those particular items. I think we have a lot of flexibility there to do the things we want to do towards getting to 100%.
Okay. Grad Night is June 4th, and I don't even know the number of the graduating class, but it's probably less than 50.
Are they not letting other events for students attend?
I don't know.
Yes, they do.
So
It's
maybe
open to them.
it's
Well,
usually the, and they can
It's
bring
been
a
in the
guest.
announcements open.
So they were wondering about that.
What does that normally look like?
Well, the class is usually really small, anywhere from 40 to
You're gonna have 100 kids.
at least that.
Where does this event happen?
The community center.
Oh.
Is it okay?
I don't know. We're gonna have to talk about that. So, I think as long as there are not a lot of new cases, then it's possibly doable with screening. People have to be screened like anywhere else. You have to be, asked if you have symptoms. You have to. I don't know if there's going to need to be temperature checks. Are we having fun yet with this? I don't know.
What kind of precautions, can I give her the go ahead with precautions that she needs to take? Because we can't do this to kids again.
Who is
Not 2 years
who
in a
is
row.
she?
Amanda Gilder, Gonzalez.
Yeah.
That's her maiden name.
That's her.
So
I
what
know
are the
everybody by their maiden names.
what are the hours of this?
It's
usually?
9
till
to,
like 6 in the morning.
yeah.
No, they cut the hours down.
Did they?
On this one. I think it's till 2.
9 to 2.
9 p.m. to 2 a.m. And what kind of events usually have they all stay usually indoors? They play games, they do.
They've
Usually
done,
have both.
they have indoor, outdoor, both.
Okay. And do we know what the capacity is for the community center?
300,
It's
the
reasonable.
2 big rooms, 300 plus,
Yeah.
and that's just the 2 big rooms.
Okay, well, that
So we're
sounds,
well within the.
sounds
capacity.
reasonable, yeah. I think that they just need to, and everyone else can chime in, they should be screened for symptoms, and if they're ill, they should not be there, just like any other common sense thing.
Okay.
If you're ill, you should not be attending a group event, even if it's not COVID, whatever it is. And masks are advised still, because that is not being released, that recommendation is still in place. So masks, hand hygiene, some stations for places they can, wash hands. Sanitize things in between if they're gonna be playing, community ball events or something like that. Common sense things. I mean, things that we've been doing the whole time. So trying to just not give each other germs, no matter what germs they are. These are high school, correct, grad nights? So how many chaperones do they usually have?
No, lot.
So,
15, 20. Because it has a different station.
Yeah,
okay, good. So they can kind of keep them in line.
yeah.
Yeah, so I mean, I think that's reasonable to go
Okay.
forward with the current same, I mean, from my perspective, everyone else needs to kind of weigh in. Sean, I, recommend you kind of put in your 2 cents as well, so. I want them to have fun, but I want them to be safe, just
Yeah.
like everything, have fun, be safe, celebrate, but just try to keep everyone else safe too. So Sean, do you have any problem with that? He is dropped off. Okay. Anybody else who's listening in have any input regarding that?
I'm all in favor of 100%.
I know,
Yes.
I know you are. Is there food at this event?
That has been,
It has been in the past, but I don't know.
it's a long time for.
Yeah,
Yeah.
right?
But
They
don't
usually
they have to go through the food
But
service?
they have the kitchen, I'm sure that
They have to pay a lot.
yeah,
Permit from.
yeah, I think they
Okay,
have to do that.
Perfect. As long as they're following all those guidelines
Okay.
and keeping things
Yeah.
clean, having frequent hand sanitizing stations, trying to keep separate, as best
Yeah.
they can.
Pretty much what they've done in school all year long.
Exactly.
Okay.
They know what they're doing. They know what they're doing. Celebrate safely. So sounds good to me. Okay. Borrow your- So as far as reopening of the pool and swimming competition, so Pat Rowe, I did speak with her briefly and sent her an email. Are you on the call, Pat?
No, I'm
Oh,
right
you're
here.
right there.
I'm in live.
What am I thinking?
Come on up.
Come on up. Thank you for coming.
You're welcome. And I do have questions.
Okay.
When the governor says on TV, if you are outside, you do not have to wear a mask, it is very difficult to make the people wear a mask at the pool.
I would think so.
It's very difficult.
Uh-huh.
So I want to know where I stand here. Because he said last night on TV. But what we do is we have these signs and it's COVID pool rules. And maximum swimmers 100, 3 feet distancing in and out of the pool. In the pool is another situation.
There's enough for
If you're not swimming, wear a mask. We don't give them the baskets. No toys in the pool so that we don't have to worry about that. We encourage them to wear their swimming suit to the pool. We haven't opened the baby pool last year, and we probably won't this year because it's just too small. We don't, no lost and found. If it's lost, it goes in the garbage. No sharing goggles, shower when entering, may use restroom, no gathering in room, and no items left in the shower room. And then we have buy a pass if possible, so we don't have to handle the money. We already have at the pool, last year, we have the shield for when they come in. We have a station for hand washing. So it said we currently are in compliance with a face guard for the entrance hand sanitizing station. And we do have a thermometer to do temperature checks. Now, in some of the rules of the paper you sent me, it said all the employees have to be tested. Most of those, everybody that's a lifeguard has been tested, I don't know how many times at the high school,
Because they're athletes.
because they're all athletes, yeah.
Yeah. Yeah, I'll have to look at that. I mean, if they're able to maintain distance and wear their masks and do all the things that they need to do when they're not in the water, if they have no symptoms,
Well, we would probably know the symptom as they came in.
yes,
You
but I
know,
mean,
you hear somebody
employees,
coughing, you say-
employees, though, I
Yeah.
mean,
Oh,
employees, yeah.
yeah.
So they're screened when they come in, right? You're not sick, you're here, you're well.
Well, and the lifeguards sit in a lifeguard chair
Right.
that's more than 6 feet.
Yeah.
Right.
So they should.
So they're not near anybody anyway. And then we have seating, we moved the seating around the pool.
Good.
And lifeguards have disinfectant to wipe down the hand railings. Each shift they wipe and disinfect.
Great.
Lifeguards do not wear masks in the chairs because they're more than 6 feet.
fine.
And for safety's sake, if you need to jump in,
You don't
Yeah.
have
the
time to
first thing you
remove
do
the
is
mask.
not worry about whether you take your mask off. And then I said we do not allow floating toys or other toys in the pool. And then I put all lifeguards have been tested at school in their sports programs, and we can temperature check. We have our little machine.
Mhm.
And then we keep a log of what they wipe down
Oh, nice,
and what time and everything.
okay.
So I don't know what more I would need to do.
Yeah, I don't think you need to do anything more.
Okay. Now, swim team is another story. Of course, if we don't get the water in it pretty soon,
Mhm.
it's just another sore subject. So we usually have around 100 swimmers, anywhere between 80 and 100. If you have a swim meet, you have about 200 or more people. So are you recommending that we not do it this year?
The thing of it is most of this is gonna be after June 1st.
Yeah, well, it's all,
And even according to the governor, 100% after June 1st.
That's the goal.
But he's already allowing outdoor sports.
Yeah,
Yeah, all outside.
Yeah.
yeah. So I don't
Yeah.
think,
so
I mean,
where,
I don't think they
where
have
do
any
we
stipulation.
stand?
You know, it continues to be a moving target, unfortunately. We can, and we can put out certain expectations, and as long as things continue to move in the right direction, we can go on that path. But if things change and we are getting a huge rise in cases, we're gonna have to step back again. And
Yeah.
that's just the reality of this horrible
Yeah.
COVID thing that we've been dealing with.
But now, do we continue even right now? See, we won't open till June, wearing the mask, because that is it.
Masks are not exempt except if you are actively participating in a sport. So if you are walking around a pool and you're passing a bunch of people, you should still have a mask on.
So I still need to fight with the parents on wearing the mask. if
Yes,
they're-
parents must absolutely be wearing a mask. They are not in the water. They are not exempt. If they are
Well,
off by themselves.
They sit there on the bench, and that's the hardest one I
Yeah,
have.
I can imagine.
They're just charming.
You would think that, because they've been wearing masks at
Oh, yeah.
school.
This point will be different than last year when she was doing it because people are used to it.
Yeah.
Except they still don't want to do it when it's hot outside, sitting
Exactly.
outside.
I get it. I get it.
Well, then they won't.
But they, at least.
But they
with their
don't.
children.
If there's a way for them to stay outside of the area and away from other people and watch, and they don't want a mask on, I mean, I think that's reasonable, but if you want to be up close and personal with folks that are competing, you need to wear a
Okay.
mask. I'm sorry.
Just suck it up.
I'm
Is that what we
sorry.
say?
Suck it up.
Well, I have it
Two
on my,
choices.
Get a,
I
get a
have it on
fan.
our sign.
Okay.
And 3 feet is okay now. That's pretty old.
And soon that's gonna probably change as well, but yeah, masks are still important. And I know it's hot in the summer. I have the fans that mist. Just bring those misters
Oh,
fans.
okay.
Switch yourself. Okay,
Cool packs, cooling packs. They can bring cooling packs. Put them around their neck. It's great.
Is
We
your
got the
mask
fun-
still effective if it's like wet?
Not as effective,
That's what I was
but that's why, you
thinking.
know,
Well,
parents should not probably have a wet mask. So I know
well,
it's
and the kids,
challenging.
you're saying that the kids should wear a mask.
If they're up and around, walking around, if they're.
Well, they're
eating,
gonna be walking around to get to the pool and all that.
They're getting-
Then-
different.
Yeah,
We
yeah,
have masks everywhere.
yeah.
And then it becomes a sanitation issue.
Then it becomes an issue because that looks like my mask, so I guess I'll just use it.
Lord,
Yep.
Yeah, I mean,
no.
they're.
If they're
there's-
in the water and they're doing their thing, they don't have to have a mask. If
No,
they're-
they can't have. them.
If they're walking from their cars to wherever and they're passing a bunch of people, they should have their mask. Once they get in the water and they're hanging out in the water and doing that, and coming to dry off and then have food, if they're walking by people, they need.
They don't
take
get to
their
have
mask.
food.
Perfect.
Except when it's sneaky.
Uh-huh.
But, so they do need to wear the mask to the pool.
Yes.
And then when they get there, once they start swimming, do they have to put it on again when they're dry?
When they're dry, if they're hanging out and just doing nothing and they're by a bunch of people, I mean, I encourage people to wear their masks, of course.
Okay. There you go.
Sorry.
But anyway, we already had all our rules from last year. We're set up. We have the sanitation, we have the cleaning stuff and everything. We just,
You guys
Need
are all
water.
set. Right.
just need the pool fixed.
So what's the update on that? I heard the grant got approved.
We have the grants approved. I raised $35,000 extra.
Wow, nice.
And we're waiting for the guy to come do it.
Does Terry have any update?
I go over there every single day and they
And nothing
don't
yet,
have an
huh?
answer.
So we were told this morning, who said that this morning, that he was
He was,
finishing a
he
job
had to
somewhere?
Finish a job in, I think it was Fallon, and then he was gonna start on our pool.
But we don't know what the job is or how long, and the whole thing is, this grant is guaranteed that those kids will swim. That was how we got the
It was
grant.
my understanding that he would start on the pool within 30 days after we signed the contract at the last rec board meeting.
Well, 30 days is up, because we're
Yeah, it
having
is.
another
We
rec
haven't
board meeting.
received the money yet.
Well,
So,
that's because
Larry
we're waiting, Larry signed it,
Yeah.
and then we get the money.
yeah, so, he would start within a, yeah, because that's when we did sign we didn't sign the contract that night. We approved it. but
We
hadn't
approved it,
signed the
Larry
contract.
had to
I
sign
had
it,
to sign
and they
it
didn't
la-
get it.
Monday
No, no,
last
no,
week.
no, I'm talking with Terra Firma with the,
Oh, with the pool guy?
yeah,
Oh,
he would start work within 30 days after that was signed, the
Oh.
proposal. So I don't know when that was signed, so,
And I do have one other question that someone asked me about in churches.
Mhm.
And they're, starting to go back in, and it's still the same rules of distance, 3 feet.
For right now, 3 to 6 feet, depending on which one you're looking at.
And
So
is there still the contact tracing?
if someone's positive,
No, just, I know where they've been keeping track of who's there in case somebody.
oh, well, that's always a good idea if you have the staff to do it,
Okay,
but. Mhm.
okay. So any other questions?
I don't think so.
Okay,
just need water.
water.
Okay, so, thank you so much.
You're
for
welcome.
presenting that. Appreciate it. All right, so we will move down to item number 6, update regarding school business concerns or needs. I haven't heard anything new from the schools or any other potential business interests. Anybody online that
anybody on there from school?
no,
I
okay.
know that there is a push to basically try and get the school district to allow the masks to come off. for the kids.
Okay.
Parents are on the agenda, the next school board agenda for that.
Well, good luck. As far as I know, that mask mandate is not going to be lifted anytime soon, especially with the variants that are going around and, you know, still ramping up immunizations, but that's going to be a state policy. That's not going to be something that we can amend through our board.
School's out in a month, like,
Yes.
that's
Actually, it's not even a month, it's like 18 days,
Excellent.
17 days.
Yeah. I know it's a drag.
So how long will we have the mask mandate?
I wish I knew.
Because Mike, the question I'm getting is, okay, we've been vaccinated, why are we still wearing masks?
Because the
About what we
variants,
have.
because the variants, and because the vaccines are 70 to 95% effective, which means there are 5 to 30% of people who could have a breakthrough infection and be transmitting. So, you know, until we have more time and more research and we can ensure that these vaccines are covering the variants that are coming out that are more infectious and are affecting younger populations and hospitalizing and killing younger people who have families and it's impacting still in a very drastic way, we're not going to know. And I mean, I wish I had a crystal ball. I don't. I'm estimating probably through the end of this year would be my guess. But that's a guess. I have no idea. Sorry.
Yeah.
It's not any more fun for me, I promise. Okay, so beyond that, next on the agenda, gave an update regarding dissemination of information. I think we've kind of been doing the same. It seems to be working okay. I haven't had a whole bunch of information as far as concerns that word isn't getting out. Has anybody heard any concerns? No? Okay. So announcements, number 8, announcements, future meeting dates, agenda items. So I have just one thing here. Sean, thank you for passing this along on the rural outreach clinic. So the student health, the University of Nevada, Reno Student Outreach Clinic comes to the rural area here every 3 months. The next clinic date that they will be here is Saturday, March 22nd from 9 to 1 at the Lovelock Community Church. They've been here multiple times in the past. Dr. Murphy and other folks are often here with them to precept. They do adult and child vaccinations, barring the COVID-19 ones. They're not able to do those yet. They do blood pressure checks, health screenings, blood tests, education, health education, management, evaluations, physicals. So it's pretty comprehensive, which is nice. It's for underinsured, uninsured members of the community. It is free. If people want vaccines besides the COVID vaccine, you can call and make an appointment and they can make sure that they have the vaccine
It's a
needed.
very good program.
Very
And we
good
put
program.
that in, I mean, those are on the desk at the entry to the senior center right now.
Perfect.
And it's also in the newsletter.
Excellent. Great. And we can maybe get this posted. Justin, maybe I could send you an email with this. Super. Okay, great. And I'll send it over to Frontier Community Alliance as well. And let's see. Have any other announcements? Anybody else have agenda items they'd like to have added to the next?
I don't think so.
No. Okay, so move on to item number 9, public comments. Again, same as
Is there a thing, there's someone, you set date for next,
we have already for the first Wednesday of June.
okay, that's what I thought.
Sorry. First Wednesday of June, same time, same place. Public comments and discussion. No action may be taken on a matter raised under this item of the agenda until the matter itself has been specifically included on an agenda as an item upon which action will be taken. Public commentary will be limited to 3 minutes per person. Is there anybody who would like to make a comment? No. Okay.
Doesn't sound like it.
I move to adjourn.
Change the distancing thing and somebody let me know. this.
Thank you again for everything. Great job raising